To do depth, we've got roughly about a 2.5 by, what did we call the other dimension?
1.7.
There's no perfect method, but what I like to do is use a cotton swab as a dipstick to the margin of the wound. And then this is kind of the area. We'll get the measure up against that to estimate depth, and that's looking to me to be about 3 millimeters in terms of depth. Last part of this, what I'm going to do, we're just going to freshen up the margin, and then we're going to lay down the graft immediately. We're going to just try to get that one margin a little more roughed up, get some of that fibrous tissue so that it can accept the graft better. And that's why the dimension, and it's all relative to where you measure. If you're measuring that inner of the fibers, you're not going to get the full depth, but that fibrous tissue is not going to progress. So now we've more adequately debrided some of the fibrous tissue. The next step will be to apply. Can we?
Yep.
Yeah, just making sure. And then this we get as close to the wound. I always like to get the graft as close to the wound, so if there's any slipping or whatever. And then if we can pivot the foot so I can kind of fold this to maximize the amount of the graft getting inside the center of the wound. I'm going to just fold it in half to start, because that's probably the closest approximation of what we have. And then what I'm going to do is I'm going to just tuck the corners in, but still making sure we get our length. And then it starts to get a little bit more accepting once it's absorbing some of the bleeding. Then we're going to take our non-stick, put that on as a padded non-stick layer. This is not a daptic, it's another. And then we're going to follow with a second non-stick up here, just in case there's any bleeding. Gauze, and then we'll finally follow, may I have the cling please. The wrap, I'm not going to do the compression because the skin is a little dry, so we'll just try to have a little bit more aeration with your cling, and then you have a little more protection for strike through bleeding. And then we'll finish by taping this up and see him next week.